This video helps us think about how to have realistic conversations when making a treatment escalation plan with patients. In the video, Dr. Chris McNally talks with a simulated patient called Malcolm. He is an elderly man admitted with severe pneumonia who's stabilised overnight. Using the REDMAP framework, Dr. McNally reaches a shared understanding of Malcolm's diagnosis and expectations. Then he explores what's important to Malcolm. The REDMAP framework has 6 steps. These are ready, expect, diagnosis, matters, actions, and plan. Ready means preparing people for an important conversation and also thinking, am I ready too? A realistic conversation about care planning happens once Malcolm understands his condition, shares what's important to him now, and is ready to talk about treatment and care options. Cardiopulmonary resuscitation could be discussed at this stage. Look out for the REDMAP steps and see how Dr. McNally communicates with Malcolm as you watch the video.
Hi Mr Smith, I'm Dr McNally. I work at the Medical High Dependency Unit. I've been asked to come and see you today because you've been quite unwell when you've come into hospital. Is that okay?
Absolutely, Doctor. Call me Malcolm.
Alright, Malcolm, I'm Chris. Okay, pleased to meet you. Malcolm, what are you aware of your condition and why you've had to come into hospital?
Well, I know that I've been a bit unwell the last 4 or 5 days. You know, I had a bit of a cough. I didn't feel very well, and I've been I've had quite a dirty spit that I'm spitting up, and just a bit short of breath. Okay. To be honest.
Okay. And what have you been told so far? What the reasons for that have been?
Now, I think they said that it was some sort of chest problem. Could it be pneumonia, maybe?
Okay. Okay. And can you remember anything about the emergency department and being in the resuscitation room?
I can vaguely remember what happened. Everything seemed to happen very quickly. I was in the house 1 minute, the next minute I was in the hospital with doctors and nurses. Yeah, you were unwell when you were in the emergency department, and the doctors there were concerned about you. I think it's good that you've improved, but I think it would be useful to discuss if you were to become that unwell again, which with pneumonia is a possibility. Okay. Would that be okay? Yeah, that's fine. It's just the pneumonia is as serious as I think it is.
Yeah, pneumonia is a serious condition. It's infection in the lungs, and you've got it in both lungs, and it causes you to feel the way that you did, and you need quite a lot of oxygen when you've got pneumonia. And yes, people can die from it. Okay.
What did you notice the doctor saying and doing? What was the impact of the doctor's communication on Malcolm? The doctor says, "I've been asked to come and see you because you've been quite unwell since you came in." Malcolm hears this is an important conversation with an intensive care doctor. The doctor says, "What have you been told so far about the reasons you had to come into hospital?" The doctors were concerned about you in the emergency room. Malcolm now knows he has pneumonia and starts to realise how unwell he has been. The doctor says, "It's good that you have improved, but it's useful to discuss if you were to become that unwell again, which with pneumonia is a possibility." Malcolm responds to information given clearly and sensitively by asking a direct question. Is it as serious as I think? The doctor explains a little more about pneumonia and says, yes, people can die from it. Malcolm uses the pause to think and nods to show he understands this could apply to him.
Well, about 4 or 5 months ago I had a fall. You know, and I ended up with a a broken bone in my hip, and I had to have a hip replacement. Prior to that, I was quite an active person. I would go out cycling a couple of times a week. I've got a dog called Ben. I would take him out walks regular as well. But more recently, as I say, with the hip, I'd been having a few falls that I haven't really told anyone about. I was just basically, I'm afraid to admit, that I'm kind of falling for no apparent reason. But since the hip replacement, I've not really been back to my full mobility. I've been having to use a walking aid. I wasn't able to walk my dog. My son has had to take the dog. He's been doing more for me in the house as well, and I've just quite struggled with it, and I'm kind of afraid of falls again in case something else happens.
Okay. It sounds as if your cycling and your dogs are quite important to you.
Oh, absolutely. They were the things that kept me going since my wife passed away a couple of years ago.
Okay. And your son Eric, we've been speaking to him. Is that who we should discuss things with? Okay. That's really useful for getting to know you a wee bit better. So thanks for sharing all
problems.
That. If we can just go back to your current condition just now, I think we need to have a plan in place. Obviously, we're hoping that you'll improve with the treatment that we're getting just now, but I think it'd be useful for us to know what to do if you were to get unwell again.
Okay.
Because it is a possibility. All right. Have you yourself had any thoughts on that?
Yeah, I have. I'm an 86-year-old man. I've had a good life. So I have had kind of the odd thought about what's the future got for me. If I'm not able to do what I'm doing just now, what's actually going to happen.
Okay. Well, the reason I've been down to see you is if you got more unwell, should we admit you up to the critical care unit and look after you in a high dependency or intensive care unit? Do you know what these units mean?
Not really. I mean, they're all just names to me.
So some people, when they've got pneumonia, their lungs begin to fail and they need quite high amounts of oxygen, and we can do that with a tight fitting mask that blows quite a lot of oxygen into the lungs. And we can also give medications that support blood pressure if things get worse. And in the worst case scenario, we would need to think about putting you into a coma, putting you to sleep, and putting a tube down your windpipe and taking you through to an intensive care unit to be hooked up to a ventilator, which is a form of artificial life support. Is that anything you've ever thought about or discussed with anyone?
Yeah, I've had a discussion with my son. I don't know about ventilators and I didn't really know much about all that until you've mentioned it there, but I've certainly had a conversation with my son Eric when my wife passed away that there's no way that I would ever want anything like that done to me, especially given my age. I'm not wanting tubes put in, and and the outcome might not be that great anyway. It might actually be worse than what it was before I even went in.
I think that's quite a realistic outlook that you've got, and I don't think you would necessarily benefit from like the artificial life support and things like that, because I don't think you would be likely to survive that.
Okay.
All right. How do you feel about that?
Well, as I said, I'm 86. I've had a good life. But I definitely don't want tubes or anything. Nothing.
I think we've came to agreement on that, and I think we should discuss it. What should we do if then that we're not doing that? And I think we should continue with the antibiotics, the fluids, but you seem to be drinking. Okay, so you might not need them, and give you the oxygen and do all this just in the ward here, and. If things were to get worse, we need to think about discussing about resuscitation. Okay, and what I mean by that is if your heart and lungs were to stop. Okay, have you heard about a DNA CPR form?
Yeah, I heard. Is that the red kind of form?
Yeah, it's a red form. Yeah.
Yeah, they were speaking about it with my wife.
I see. Okay.
So I do know a bit about it, but again, it was my son that dealt a lot with that at the time, but I do recall.
Do you know what it means and what it doesn't mean?
Well, I know that it means, well, you don't want anything, but I don't know really the ins and outs of the form.
So what it means is if your heart and lungs were to stop, there's what we would do, we call it cardiopulmonary resuscitation. But in some people like yourself, and given your underlying health problems, frailty, and your age as well, it probably wouldn't be successful. It doesn't always work, okay? And I don't think, based on what you've said and what you wouldn't want done, because if it were to work, then you would need to go to intensive care and things like that, and I don't think that's in your best interest.
Yeah.
Therefore, I don't think cardiopulmonary resuscitation is in your best interest, okay? So I think we should probably put that form, similar to what your wife had, in your notes. But what I need to explain to you is that it doesn't mean that we would withdraw treatment from you or care. It just means we wouldn't do treatment that we know would be unlikely to be successful, okay?
Yep.
All right. Any questions about that?
And obviously, it makes you worry a bit, but at the end of the day, as I've said, I'm 86. I don't want anything like that to go on. I'd rather pass away peacefully than people running about. Okay.
I think what would also useful to say and mention that if you become we'll give you the treatment to treat the pneumonia, but we can also treat the symptoms that come with the pneumonia a wee bit better. And I can see you're actually quite breathless just now. Is that?
Yeah, absolutely.
And sometimes medications to help with that actually makes you feel a bit better. So what I mean by that is some morphine that you take, and it's just a liquid under the tongue that the nurses can give you. Okay. And I think you actually might benefit from that just now. Okay. Would you be willing to try that?
Yeah, I'll try anything, Chris.
Okay. And that's a different way that we can care for you. Okay. And I think what I'll do now is I'll probably go and speak to your doctors on the ward. I'll document this discussion in your notes, and then, with your permission, is it okay if I speak to your son, Eric?
Would that be absolutely,
all right? Yeah. Okay. Thanks very much for having this difficult conversation with me. I know it's not easy, but I think it's very important for how we care for you in the next few days or so. Okay. All right.
In the second part of the video, how did the doctor find out what matters to Malcolm and discuss a treatment escalation plan with him? How could you use some of the effective approaches to communication you've seen here in your own work? The doctor says that before moving on, he wants to know about Malcolm and what matters to him in general. This lets Malcolm share information about himself. The doctor says, "Have you had any thoughts on what we should do if you were to get unwell again?" Malcolm has thought about the future, but would like to know about intensive care. He's now clear ICU is not something he would want. The doctor says, "That is a realistic outlook. I don't think you would benefit from artificial life support. I don't think you would survive that." Malcolm hears that ICU is not an option that would work for him, and that he's not faced with a choice to make. Having talked about what the team can do to care for Malcolm, the doctor explains what CPR is and why it would not work for Malcolm. Malcolm shares what happened with his wife, agrees with the doctor, and hears that a DNA CPR form does not affect any other treatments that can help him. Malcolm and Chris agree on a plan, including a call to update Eric, Malcolm's son. So, in summary, REDMAP is a good framework to structure these important conversations. Remember, READY is about preparing people for the conversation and thinking, am I ready too?